Good afternoon, Mr. Chairman.
Thank you.
And distinguished committee members. I appreciate the time, and I'll be as brief as possible.
I wish we had more time.
Thank you, Mr. Chairman. I appreciate you giving me an opportunity. I brought some folks down, and I'll be brief. For the record, Michael Brown, 50th District, Mr. Chairman. This bill, been carrying 1405, talks about a single-payer system for Missouri. I've been promoting it for a number of years. I know it's not a popular idea, but I think we need to talk about it, and so I appreciate you guys even hearing this idea. We're having a healthcare crisis. We're having a healthcare system already. It's not universal. It's kind of a broken system where it's here, there, it's patchwork. We're trying to fix it as best we can, but as we note, and as you note, the budget every year gets higher and higher for healthcare. I don't know what we're going to do. It's going to be 60% of our budget if we're not careful before long. I won't be here because I'll be gone in 2 weeks. But you young people, and I mean you freshmen and sophomores, and even though you are young representatives, will have to face this every year when you go through the budgetary process. And as we go back upstairs, we're going to go through some more of it. This system would, we didn't mention that we are paying into 3 agencies, Mosier University System and Highway Patrol. Those systems would go underneath this umbrella. If you look at the fiscal note and some of the other things, and we look at the initial cost of $27 million, but we're saving $1.3 billion, and we're getting a better healthcare system if we were to buy into it, if we were to think about controlling our own fate, having self-determination, and maybe coming up with a system where Missouri's in a position to negotiate with Big Pharma. Maybe we're not paying $10 for an aspirin, and those ER systems, those emergency rooms, aren't overburdened, where hospitals even have to shut down. I'll stop there, Mr. Chairman, and I didn't go completely over the bill. We brought some folks that want to talk about it.
Thank you.